Hi, Dr. Rika again, reporting to you about the 4 words you should never hear your doctor say. And this is part 3. So hopefully you've seen part 1, which talked about glucose and insulin, or what I call metabolic dysfunction, and part 2, which covered the complete metabolic panel. Part 3 today will cover the complete blood count, also known as the CBC. So this is a standard test that even your regular primary care doctor will order, but a lot of times you're told your labs are normal and there are subtle findings that really should be addressed. So in this particular patient, she was in her mid-50s and she was fatigued for a long time. And fortunately for her, we had long-term evaluation of blood counts over the years that she had put on file from her prior doctor. So we knew that these things were just worsening over time. But they started out as normal or low end of normal. So the first value we're going to talk about is the WBCs, or the white blood counts. So our white blood cells help us fight infection. When we have a viral infection, those numbers will go down. So it'll be lowered or suppressed. When we have a bacterial infection, you'll see that the numbers elevate. The numbers also will increase or decrease if you have some certain types of cancers. So in her case, the normal for most labs is about 3.5, 3.4. She was coming in right around that normal value for years until over the last 2 or 3 years she started dipping below it. And the last time we checked her, she was at 2.6 and she did not have a viral infection. So what's more robust is a value of 4.0, and that allows your immune system to function proper. So this means that there's something going on. And one of the most common things I see is chronic exposure to environmental toxins that's suppressing the immune system. So she was chronically suppressed and that number was dipping lower and lower and lower. But because I didn't want to miss something like a cancer, I did have her see her hematologist. And the hematologist did further blood testing and even a bone marrow biopsy. And guess what he said? There's nothing wrong. And so there couldn't be anything further from the truth. Now is the time to intervene before she gets chronically infected with viruses or develops other issues. So that's the first thing we see, is that she was chronically low, but everyone said it was normal. And even now, when she's lower than normal, she's being told she's normal, and that's not true. The second value we're going to talk about is the MCV, the mean corpuscular volume. So that's the size of the red blood cell. And the larger size red blood cell, especially if that value is up over 90, and you can see her value is at 94, suggests that there's a B12 or folate deficiency, which was the case in this patient, and kind of correlated with her fatigue as well. And so a more robust value is between that 80 and 90 mark. So that signifies that the red blood cell is a normal size. When it's below 80, it means it's too small and can be other things such as iron deficiency, etc. And the third value I'm going to highlight here are the platelets. So for this particular patient, her platelets were 155,000, and the lower limits of normal were 150,000. She was only 5,000 above, and given her history of that white blood count coming down, one of the things that also happens is that chronic environmental toxin exposure can drop your platelets down. So those triggers need to be removed so it doesn't become a problem. So there is a condition called idiopathic thrombocytopenia, and that means low platelets for an unknown reason. So the regular doctors will tell you it's not known, but you really need to explore what is the lifelong exposure to toxins. And believe it or not, one of the things I'm finding is you can have your water, the drinking water in your home, even if you filter, it's not enough to filter through your fridge or through a Brita filter, can be contaminated with environmental toxins such as gasoline, so gasoline byproducts. So that's just one of many, many examples. And when I work with a patient, these are all the things that we go through to determine what is that person's cause, and sometimes we even measure them. So I hope you found this informative. If you didn't watch part 1 or 2, I'll put part 1 and 2 in the link in the comments.